Just a point of perspective here on the following up on our hearing in Hoosick Falls last week, where we went 10 hours with that, and you were at that one as well. So I'm not going to rehash the questions that I went through there, other than to follow up on one point that I made there, and that is the relationship and cooperation between EPA, Department of Health, DEC. Last week at the hearing, there was a letter that both commissioners penned and dropped to Judith Enck, the regional commissioner of EPA, at the time of the hearing. Then throughout the hearing, EPA Regional Director Judith Enck was communicating with the press and the media, commenting on everything that was being testified at that hearing last week, yet refused to appear and testify herself at that hearing, has continued to refuse to be here today and testify at this hearing for us, and I think that would be a much more effective dialogue for all of us and those watching to be able to get her perspective on this. But yet, here we are again today, and there's another letter issued by you guys to the EPA, and now there's this federal Superfund moving the nomination forward today. So it doesn't appear to me that these relations between EPA and Department of Health and DEC, between the state and the feds, are improving. And what I really want to know, and I know that the residents certainly of the Hoosick Falls community are extremely frustrated over this finger pointing back and forth, and what are we doing to improve these relations? We have limited resources at both levels of state and federal government. We need to work together on these things. How do we improve that going forward, that relationship?
Well, I think that, well, one, I agree that collaboration is critical to the success of this and anything else that we're doing. We've reached out to EPA. We did receive letters back. We wish they were here today, and I think the dialogue would have been better and had a chance to answer some of the questions that have been raised. I think, as I mentioned before, the inconsistencies at the end of 2015 caused the confusion that we had, but in years past, we were able to have a better relationship on some of these issues.
Do you have any explanation from EPA? I know that the State Department of Health didn't act in issuing a do not drink order. EPA was aware of the situation over this 18-month to 12-month period that we're discussing about. Any explanation to the EPA as to why they didn't issue a do not drink order earlier?
This is a question, again, for them. I can say that our team had been in touch with EPA. They knew what we were doing. They didn't bring anything to us saying that you should issue a do not drink order earlier in 2015, and then in November 2015, as we all know, they issued this letter. So I think this is a question really for them.
Well, I think we need a much more wholehearted effort on behalf of the both of you and your departments and the state and with our federal representatives to make sure that we get this cooperation going forward that we need to not get in these situations. Because I think we could have and probably should have acted sooner in this case, at least giving warnings out there for people to make their own determination of whether they wanted to continue drinking the water or not during that period, at a minimum. I do want to turn the topic just a second to the school testing for lead legislation that the governor signed yesterday. And as an example of the ability of your department to act quickly when motivated to do so, regulations were issued today, I believe, and filed that are now effective, and guidelines for the testing of school water. So I assume you've been working on those since legislation was passed, knowing that it was something that certainly myself and Assemblywoman Lepardo, who's here with us today, championed in the legislature, and the governor's office in Department of Health and Education got involved in the final negotiations of that legislation. So in the past 2.5 months, you've been able to come up with regulations for the testing of that, and I commend you for doing that. I wish we could see quicker response on other issues, such as we're here mainly about today. But on the lead testing, you've come out with a standard of 15 parts per billion. In here in Hoosick Falls, it's different chemical, different whatever in the water. We're talking parts per trillion in the water, which is, I think, a much smaller quantity. What did the standard of 15 parts per billion come from? How did the Department of Health come up with that standard?
Sure. You know, Nathan, you want?
There's an existing EPA action level of 15 parts per billion, so it's that action level.
Okay, so are we going to find ourselves here a year or 18 months from now arguing about 15 parts per billion action level? And whether that was too high or not, or too low?
I think the one thing about
Today.
I think one of the big things about lead, it's a regulated contaminant. We've had a lot of research on lead over decades that we've learned, and so I think the science, a lot of science on there at that point, and I think a lot of these unregulated contaminants, particularly PFOA, is evolving, and hopefully we will be able to get to the point where we have answers as clear as we do on lead.
I think it was astonishing to most people that type of testing hadn't been required in schools or any other buildings, and there's been certainly suggestions that the testing should be broader in different types of facilities. I think the starting point of schools is a good first step, and we need to look further, and we certainly look to your guidance and the DEC's guidance on what other types of facilities this type of testing should potentially be mandated in. It certainly is expensive, and we've gone to great lengths to try to cover those costs in the legislation. But it is an example of how quickly we can act, and we should be acting in response to these issues. I mean, this is something that moved through the legislature in one session, which is largely unheard of for any issue. And then to have the department come out with regulations the day after the governor signs the bill, it's all good in this instance, but I'd like to see it better in many other instances as well. Thank you.